We will be speaking with infectious disease specialist Ela to outline potential disease outbreaks caused by the spill.
Good afternoon. I'm Dr. Ela and work for Infectious Disease Society of America. There have been greater concerns among public on the health hazards due to recent oil spill in Salt Marsh close to Pirate Island. I'll be leading the team of infectious disease specialists to investigate and find solutions for various diseases due to this catastrophe. In the last few weeks, there have been cases reported due to food, water, and skin contamination. Our team will investigate these cases and will provide appropriate remedies to the problem and also would recommend appropriate preventive measures. Now, let me go to the specifics on food, skin, and water contamination. The oil spill in the Salt Marsh is unprecedented. The amount of oil spilled into the environment poses unique challenges to human health. At this moment, we don't have answers to all the problems, as this spill involves complex potential health impacts and we need to gather great amount of data. So far, we have been testing various water samples, food samples, and air samples. Waters have been closed for commercial fishing. Once CDC confirms the water is free from harmful levels of chemicals, decision will be made to reopening of waters. It is not prudent to eat fish that look distressed or behaving strangely or have been found dead. Contaminants associated with an oil spill can be detected with simple sensory checks for odors. Any fish or seafood with an oily, fuel-like odor, either when raw or cooked, should not be eaten. One of the recommendations is to stay away from all seafood that has been caught in Pirate Island. Within the few weeks, a lot of cleanup workers have been attended to medical cares for symptoms like headaches, vomiting, cough, respiratory stress, and chest pain from inhaling the chemicals from the oil spill. Respiratory issues are the biggest problem for people who have been involved with the cleanup. It is highly recommended to wear masks if you are going near the shore. Skin contamination. High exposure to oil and dispersants is harmful to human skin and could result in dermatitis and secondary skin infections. An occasional brief contact with a small amount of oil does not harm. However, some people are especially sensitive to chemicals, including the hydrocarbons found in crude oil. They may have an allergic reaction or develop dermatitis or a skin rash even from brief contact with oil. Prolonged skin contact with crude oil and petroleum products can cause skin erythema, that is reddening, edema, and burning. The skin effects can worsen by subsequent exposure to sunlight because trace contaminants in the oil are more toxic when exposed to light. Some persons may be or may become sensitive to the crude oil. Depending on the amount and duration of exposure, skin contact with crude oil may be moderately irritating. There are also dangers from chemicals called dispersants used in the cleanup. The solvent used can cause skin inflammation and asthma. People with underlying respiratory conditions such as emphysema or asthma, as well as pregnant women and fishermen, are also at increased risk of health problems from the spill. People can be exposed to hazardous substances related to the spill by breathing air, by swallowing food and water, or by touching the skin. Water used for recreation may be affected. Swimming in water contaminated with chemicals from the oil spill could cause health effects. If possible, everyone should avoid the oil spill affected areas. Oil spill workers may need to wear personal protective equipment on the basis of the particular cleanup duties that they perform. It is important to understand the potential toxic effects and take appropriate protective actions to reduce exposure and harm. It is highly recommended that you don't take your dog for swimming.